Hello, my name is Teresa. I'm going to be your nurse for today. And what's your name?
Shamar.
Hey, Shamar. And how old are you?
17.
And I understand you're here for abdominal assessment today?
Mm-hmm.
Okay, so I'm going to go ahead and wash my hands. Put me some sanitizer on, okay? All right. So what we're going to be doing today, I'm going to go ahead and be inspecting your abdominal area, which means I'm going to just be looking, okay? I'm going to do some general percussions, do some light and deep palpations, which means I'm going to be tapping and feeling on your abdominal area. I'm also be doing some auscultation, which means I'm going to just be listening with my stethoscope with the bell and the diaphragm, which means in the small and the big part of the stethoscope, okay? So first we're going to go ahead and get started. We're going to go ahead, I'm going to start off with inspection. I'm going to get down at eye level, look at the contour and the shape of your abdomen, looking for any scars, lesions, any no peristalsis, no visible peristalsis, no pulsation noted. Your umbilicus is midline. Okay, all right, next thing I'm going to do, I'm going to go ahead and I'm going to listen to your bowel sounds. Okay. Next thing I'm gonna do, I'm gonna go ahead and listen to some vascular sounds. Some vascular sounds. Okay. Listen with the smaller part of the stethoscope, which is the bell. Listen to your aorta, your renal, your iliac crest, and your femoral. Okay, any pain or tenderness?
No.
Next, I'm going to do some generalized percussion. Just be tapping along the way in the same areas, okay? Doesn't mean anything wrong. Okay, next I'm going to do some light palpation. Okay, next I'm going to do some deep palpation. All right. The next thing I'm going to do is just check it for some organ swelling, okay? First thing I'm going to do is check your liver, okay? Just put my hand underneath here, lift you a little bit, go right underneath your rib cage. Take a deep breath for me. Any pain? Okay, I'm going to do the same thing on this side. Lift you up, checking your spleen, okay? Deep breath for me under the rib cage. All right, good. Any pain or tenderness?
No.
Next, I'm going to check your kidneys. Okay, I'm going to do the same thing on this side. Any pain or tenderness?
No.
All right, good. Next thing I'm going to do some specialty areas, okay? First area I'm going to check is for your gallbladder, and that test is called the Murphy test, okay? Take a big, deep breath for me. Any pain? Any tenderness? No? Okay, good. Next thing I'm going to check is your McBurney's point test, okay? I'm going to just press in tenderness.
No.
How about when I pull out? On this side, I'm going to check your Bloomsbury test. Okay, I'm going to press in the same way. Any pain? Tenderness?
No.
How about when I pull out? Okay, good. All right, on this side, I was checking for any appendicitis as well as on this side, any appendicitis, any pain or rebound effect, okay? We got one more specialty test, which is called the ileoPsoas test. Okay, I'm going to check, and that's also checking for any type of appendicitis, okay? Go ahead and try to lift your leg for me. Any pain or tenderness?
No.
All right, lay down. Go ahead and do this one. Any pain or tenderness?
No.
All right, go ahead and Lift down. All right, now can you sit up for me? Turn all the way this way for me, sir, to the camera. All right, well, I'm gonna check on the back side. This is checking for CVA tenderness, which means I'm gonna be just checking your kidneys, okay? Okay, I'm gonna place my hand here. Any pain or tenderness? All right, I'm gonna do the same thing on this side. Any pain or tenderness? All right, sir, I want to thank you. That completes our abdominal assessment for today. Have any questions or concern for me? If not, go ahead and step down and thank you again. Okay, so now I'm going to go ahead and do my report. All right, I'm going to go ahead and give a report. I had a 17-year-old male that came in today for his abdominal assessment. First thing I did was inspection. I inspected his abdominal area. I looked at his contour and the shape of his abdominal area, which was flat and symmetric. I looked at his color, was appropriate for his color. I looked at any scars, any lesions, any striae. There was none. I also looked at his umbilicals, which was the midline. No pulsation or no visible peristalsis noted. Then I went ahead and listened to his bowel sounds. Bowel sounds was present in all 4 quadrants. I did general percussions, negative to general percussions, no tympanic or no rebound renaissance. I also did light and deep palpation, which was negative to light and deep palpation. I did his vascular sounds, the aorta, the kidney, the renal, the aorta, the renal, iliocrest, and the femoral was all negative. The next thing I did, I went ahead and was unable to assess his organ swelling, where I assessed the liver, his spleen, and his kidney areas. Then I went ahead and did the specialty test. The Murphy's test was negative. The McBurney's point test was negative. The Bloomsburg test was negative. And the iliopsoas muscle test was negative. On his, I said renaissance, on his vascular assessment, where I assessed the aorta, the renal, the iliac crest, and the femoral, that was all negative. No bruit or thrills noted. This completes my assessment. Thank you so much.